Hi, welcome back to Straight Talk. We're talking about healthy families, healthy babies in the Baltimore metropolitan area. And we're getting some great information that hopefully all of you can share, if it's not for your own families, for someone else, to get them the help they need, with the goal being healthy babies. And joining me now, Rebecca Dineen is back to help us from the Baltimore City Health Department, and Latta is with us from the Family League of Baltimore. And you have a bunch of initiatives working with healthy babies, healthy families, and making that connection. It's so cool. I mean, you know, everyone talks about Baltimore and the region, but it's so cool when everyone's working together. And all these agencies come out that people didn't know, you know, and this is wonderful. So tell me about what the Family League is doing.
So one of the biggest things that we're doing with Be More for Healthy Babies is around home visiting. And so in partnership through Be More for Healthy Babies, there's a citywide home visiting system. And really part of that is making sure that it's easy to connect women to those services. And so regardless of sort of where or how a woman gets into the program, and basically through
Healthcare Access.
Through Healthcare Access Maryland, women get connected to home visiting and will be suited or connected to the program that is best suited for their needs. One of those, most of these programs are for women pregnancy through the child's reaches their 3rd year. And then the other, one of the more innovative programs is called HFA Hope. And it's for women who've suffered a loss and who've lost a child. And they offer one-on-one home visiting services by a peer. And so through a person who's also had a fetal or infant loss.
This is run out of the Family League of Baltimore, is that?
So we fund a program and work in partnership on these home visiting programs and offer support to all of the programs throughout the city. Go ahead.
And another part of her home visiting system that's run through the health department, but is a really important question that you had asked a little earlier, is around what other issues do we have in Baltimore City? And teen pregnancy is a major issue in Baltimore City. And we want to be sure that every teen in the city has access to home visiting services. And so we have specialized services that are suited just for teens. And teens sometimes are reluctant to share that they have a pregnancy for so many reasons. They might be scared, they might not know, they might not understand. And so we want to have welcoming arms out to our teens and offer home visiting services. So that's another specialty population. And
I think the important thing is that regardless of where a teen lives, or if she's in transitional housing or even homeless, we can still service that family or that teen. It's really important. A lot of the times people think that that's not a possibility, but our home visiting programs will serve somebody regardless.
Who are the home visitors? Who makes these visits?
So it's a wide range. So we have nurses, we have social workers, we have paraprofessionals. A lot of our home visitors live in the communities that they serve, and are highly trained, and so wide variety.
Are these paid volunteers, a mix?
They're all paid.
No, I'm going to look for volunteers for you. If you
I'm
trying to make a pitch for you to get them out.
Yes. No, they're paid, and they work harder than anybody I know, and will do everything that they can to support the families that they serve.
So they're going in and doing this work right in the house.
That's right.
So there's really no excuse for anybody not to get services at this point.
Right.
That's right. Or they will go to a shelter, or if somebody's uncomfortable in their home, they'll meet them at McDonald's. They'll meet them anywhere. So, yeah. You
know, again, it's amazing to see that these services are there and how many won't use services. And I always wonder, I mean, what do you think? Why do you think people are hesitant? Is it they don't know, or they're just afraid?
I think it's a combination of factors. I mean, I think one is really getting the word out, and I think that's so important. And that's why with any message that we have, whether it's about the ABCs, the alone back crib of safe sleep, don't smoke, or it's about home visiting. It's keeping it very simple so that people understand that these aren't complex services that are scary, but just very simple services, very simple messages. So one is just getting the message out widely. We've actually even used jury duty to get messages out now about our programs, about the ABCs of safe sleep. So it's a similar way we would approach for home visiting. Another reason that women may not choose home visiting is because maybe they don't want people in their homes because they think of it as home visiting. So we are looking at rebranding to make it more of a companion program, to allow people to understand that actually these services can be offered anywhere. It's really a coach, it's a mentor, somebody who oftentimes went through the same hardships you did and are somebody who just wants to lend a helping hand. And I think the other issue is that there's a lot of concern about health services, but for people who have substance use disorder or have concerns with mental health. They may be worried that their baby might be taken away from them if they use the services. And so we are really looking for women who can be home visitors who are in recovery so that they can help folks understand that this is not about crime and punishment. This is about supportive way to embrace our population and make them as healthy as possible.
That's a good point.
I think the other thing that's really interesting to know is that there are several home visitors now who actually became staff after going through the program, and so they saw how much it benefited them and really changed their lives for the better, and then they
probably make some of your best. I mean, it's like peer counseling.
So dedicated and amazing.
These peer-to-peer that they really understand it. The barrier around losing your child, huge in substance abuse. I mean, they really are afraid, and they see laws and they go, oh, I'm going to lose my child, and so they'll stay on the streets longer, which obviously is not very good and not very healthy. But that's important. But having a peer go in, I think that's really. Now, will you train them?
Absolutely.
Absolutely. They'll get trained?
And they're trained through an evidence-based model. This is a research-based approach. It's not sort of an ad hoc training. It's very specifically. But we have found, like the program that works with women who've had a fetal and infant loss, the difference between being engaged by somebody who's had that experience versus being engaged by a social worker who hasn't is very different. So using peers who've had these experiences who are highly trained is incredibly effective, and we've seen a big difference in the numbers of
Now, is this run through the health department, or is it actually?
It's all in partnership.
So if somebody wanted the service, who would they call?
So Healthcare Access Maryland.
Healthcare Access Maryland.
And that's what's really amazing about this, what we have now, is because before, in 2009, you couldn't get connected. It wasn't to programs. It wasn't clear. All had different eligibility criteria. Some were operating in the same areas of the city, while other areas were completely uncovered. And so now, through that one central location, through Healthcare Access of Maryland, you get connected to all of these different services, and they do the hard part of figuring out what program is best for each person. And so while there's all these different agencies, and I could tell you about each of the different home visiting programs that Family Leagues funds and supports, but
it all goes through healthcare. Okay, well, that's what we want people to know. So again, thank you, guys. This is great information.
Thank you very much.
Terrific information, and best of luck.
Well, thank you so much for having us.
Our pleasure.